Let's move on now to Africa. The Ebola outbreak in Central Africa is worsening rapidly, with the death toll in the Democratic Republic of Congo now crossing 200. Africa has now classified the Ebola outbreak in the DRC and Uganda as a public health emergency of continental security. Health officials are warning that the virus could spread to several other African nations. India has dispatched the first tranche of urgent medical supplies and protective kits to the Africa Centers for Disease Control and Prevention. In a post on X, External Affairs Minister S. Jaishankar said the supplies have been sent in response to the emerging Ebola public health emergency. Authorities in the Democratic Republic of Congo say at least 204 people have died in the latest Ebola outbreak. The Congolese Health Ministry says nearly 870 suspected cases have now been recorded across 3 provinces. The World Health Organization has declared the outbreak of the highly contagious disease an international emergency. The Africa Centers for Disease Control and Prevention has warned that at least 10 countries are now at risk of the virus spreading beyond the DRC and Uganda. Both organizations have now unveiled a 6-month Ebola response plan for outbreaks in the DRC and Uganda. With a $319 million budget, the plan covers all 55 African Union member states. Amid this, Uganda has appealed to the international community for funds to contain the Ebola virus. Meanwhile, health measures have been ramped up in DRC's Ituri province, which is said to be the epicenter of the outbreak. Cleaning efforts remain underway in the Mwalu General Hospital, where fresh cases of the disease continue to mount. Officials say high cross-border movement and insecurity in the conflict-hit region are making containment difficult. Uganda has now confirmed 5 Ebola cases since the outbreak was detected early this month. 1 person has died there so far. India has advised citizens to avoid non-essential travel to the DRC, Uganda, and South Sudan amid the outbreak. Indians in the region were urged to follow local health guidelines and maintain strict precautions. Ebola spreads through direct contact with bodily fluids and can cause severe bleeding and organ failure. The current outbreak is centered in eastern Congo's violence-hit provinces of Ituri and South Kivu, where years of armed conflict have weakened health services. Meanwhile, 3 volunteers of the International Federation of the Red Cross and the Red Crescent Societies in Congo died after apparently contracting the virus during humanitarian work. Africa CDC chief Dr. Jean Kaseya says that Ebola response teams in Congo are facing severe shortages of basic medical supplies despite millions of dollars in pledged aid. Frontline facilities are reportedly struggling to secure protective gear, laboratory equipment, and treatment space.